So I met with the mom, had an assessment period. One of the things that I'm thinking about several things that I'm thinking about during the assessment period is developing a collaborative relationship with the parent. So not only just a sort of developing rapport and the beginnings of a positive therapeutic alliance like we do with everybody. This in particular, because of the parent's unique role as their secure adult, or the potential for that, it's important in this model in particular that I work collaboratively with them. Mm-hmm. So thinking about building that relationship with the parent in the midst of assessing for the child's needs. And also, of course, introducing them to therapy. It's more often than not, in my experience, that the families don't have any experience with therapy. You know, sometimes, especially if the parents are younger, they haven't been alive very long, and certainly the little kids haven't either. So kind of socializing them to what therapy is, what it looks like, and in particular play therapy, because a lot of people they see a child play, even sometimes when the children are reenacting the themes, the adult might not understand that this is the child's way of sort of, mm-hmm. It's the child equivalent of talking about their feelings and thoughts, for example. So I observed them at school, observed them home, do a play observation, do some other like concrete quantitative measures like a CBCL, child behavior checklist, and really getting a sense of how the parent understands the child's problem. And one of the things that became clear, which would have an impact later on in the treatment, is that mom was fairly depressed, and I never learned exactly when it started, but because of some of her own trauma and loss from the past, she had somewhat of a depressive personality, which was only exacerbated by the loss of the uncle who she was very close with. So one of the things that I think about in the assessment phase, and I may assess for this formally or informally, more often it's informal, is this idea of these ideas of angels or ghosts in the nursery. So ghosts in the nursery was a term and a paper written by Selma Freyberg, who's kind of like the grandmother of infant mental health. And it's basically the traumatic, the wounding, the neglectful experiences in relationship to their parents that the parents of my patients have when they were young. Mm-hmm. So it's sort of like what they bring with them from their own early experiences. And so a woman named Alicia Lieberman, she and Patricia Van Horn started, or I guess created, child-parent psychotherapy. And she wrote a paper about kind of the opposite of that, the angels in the nurseries. What were sort of those positive experiences that the parents, when they were children, had with their caregivers. So those are the kinds of things I'm trying to suss out in the assessment phase. In addition to all the normal stuff like taking developmental history, finding out, the biopsychosocial data that plays into the presenting problem potential. Mm-hmm.
Let me just interrupt you briefly. So when you read the file or the intake form, did this young lad present to you for a specific reason